Welcome to United Hospital, Janagar. Today we have with us Dr. Suhasini, our ENT consultant and rhinoplasty specialist. Welcome, ma'am. Thank you for speaking on this topic.
Hello, dear. Thank you very much.
What is rhinoplasty?
Rhinoplasty in layman's term is nose job. So what we really do over there in rhinoplasty is probably change the shape of the nose, different sizes of the nose. Probably we plan to achieve a better nose. That's what we plan to do. But yeah, rhinoplasty basically means a nose job. Yeah.
Is it used only for cosmetic purposes?
Yes, so what most of the people do think of rhinoplasty is that, because of the selfie era and because of all the actresses and most of the models and probably Instagram, Facebook and all of the places where people show a lot of pre and post pictures of nose jobs. So people think it's only used for cosmetic purposes. Of course, we change the shape of the length, height, width of the nose, probably even the symmetry we try to achieve from this. These are all they are all aspected towards the cosmetic aspect of the nose. However, there are certain situations where people actually can't breathe. There is nasal obstruction which is causing a lot of trouble to the patients, and these are also sometimes requiring rhinoplasty along with septoplasty, and we call this together as septorhinoplasty, and that gives a better result to the patient if at all we combine both the procedures and do it. So even a functional defect will require a rhinoplasty at times.
Mm-hmm. This is noisy breathing, ma'am, or is it breathing difficulty?
Yeah. It is breathing difficulty. People who have been having noisy breathing, people who have been having, so people who would have had probably a trauma. So many a times, all these youngsters who would be playing football, kabaddi, boxing, most of these people would be having probably a punch nose or a nasal trauma out over there. At times, road traffic accidents, which would probably leave them in really grievous injuries to the nose. So these are the people who would really be benefited by rhinoplasty as well. Yeah. And so there are many other systems where there are these variations from genetic variations. Probably when they are born, the congenital defects like cleft nose that is there for most of the patients. Such patients also will be benefited by rhinoplasty.
What to expect, ma'am, when the surgeries of rhinoplasty?
So when a person comes up to us and says, okay, do I really want a rhinoplasty, and they come to our OPD and ask us saying, look, I really need a nose job. And most of the times they don't really walk in by asking for a nose job, but yes, of course, on a cosmetic aspect, they do ask the same way. This surgery is done under general anesthesia. It goes on for about 2.5-3 hours, and different graft materials are required. Of course, there are a lot of people who would choose to use synthetic elements like silicone, Gore-Tex, and etc. But of course, nothing is better than an allograft, that is our own graft. So we prefer to use our own septum or the ear cartilage, or sometimes the cartilage which is there from the harvest from the rib area. So these are all the factors which we'll have to probably explain the patient before undergoing the surgery. Yeah.
How to assess, ma'am, if this person is fit for the surgery?
Yeah, if the person is a really good fit for surgery or not. Yeah. See, actually in India, if you look at it, we have there are different ethnic variations. So if you look at countries, say an African nose or an American nose or probably a European nose or a Asian nose. See, all of these have characteristic nose. A Caucasian nose is absolutely different from what an Asian nose looks like, and their nose looks absolutely different from what an African nose looks like. But if you look at India, we have all the variations in our country. So when you go towards the northern part of the country, we have this Aryan type of nose. When you go towards the eastern part of the country, you have all these Asian type of nose. Whereas on the western type, you have somewhere on the Dravidian side, western type. They're a little more towards in between an Aryan type and a Dravidian nose. Central tribal, they have a typical, this upper part of the nose is a little thin, whereas the lower part of the nose is actually quite thick. Whereas if you come down to the southern part of the country, they have this thick skin nose, which is kind of thick from probably top to bottom. So a lot of mixed races are there in India, and it's actually a beautiful place to really learn rhinoplasty and also enjoy rhinoplasty, probably to even operate.
And new learning for us, so interesting.
Yeah, it is, and in fact, to be quite honest, these are all the things which are taking place because of even climatic influences on the nose. So a lot of changes and shapes takes place because of the climatic influences over here in different. If you might ask me as to why is this difference, it's not just because of the genetic and the race that's taking place out of there. Even the climate does a good deal of influence in these. You know how the air we breathe in and exhale, they also are helping in changing the shape of the nose. That is so skin per se. I would like to look at how even the skin quality is. If I have to say, if the person is going ahead with the surgery, it's not just about how the nose looks. And second is of course the age. I would like to tell you that age is a good or a great contribution out of here. Nose usually grows up to the age of about 18 years in men and for about 16 years in females. So people who come after this age is when we ask them to wait. If they do not have any breathing difficulty, and if it is just for the changing the shape of the nose, we would ask them to wait till about 18 to 20 years and then go ahead with the surgery. But of course, if they've been having difficulty in breathing and it's been causing a lot of delayed growth and not able to concentrate in class much, and they require both combination of septum and rhinoplasty together, then probably pediatric septal rhinoplasty is indicated in such people.
What are the factors, ma'am, that influence the surgery?
Again, as I mentioned, these factors are very important. Most importantly, as I mentioned, age is an important factor, skin is an important factor. I would like to know whether the patient has a thin skin, thick skin. If you look at it, a thick skin, I would probably do immense amount of work inside, and then you close the blanket with the thick skin. Whatever you have done that is not going to be beneficial. It's a double-edged sword. Sometimes you might botch up the nose job, but the skin is going to take care of it. But again, of course, if you probably do a good job, it's not going to be defined as well with a thick skin. Whereas if you go with a thin skin, so thin that anything that's taking place underneath is going to be seen very, very evidently. It's going to reflect right out over there to people. And of course, even counseling the people that this might actually change the way they look and appear. They would have been probably looking at themselves in the mirror for so long, and they would be probably looking at themselves in a specific way. And suddenly when you change the shape of the nose, they have a lot of issues in understanding or probably accepting whether they can go ahead with this changed shape of the nose and face.
What are the risk factors, ma'am? What all is
just as any other surgery? This is, as I mentioned, is going to be done under general anesthesia. So the minimal few anesthesia side effects that will be there with the anesthetic drugs, which most of the times we have good anesthetists out over here who take care of beautifully. Of course, along with that, there are certain things which, of course, everybody need to take that risk, 1 in 100 or probably 0.5 in 100, which even we do not understand, we humans do. So such risks are definitely there along with it. Other than that, maybe bleeding and some amount of swelling around the nose and face immediately after the surgery, which will reduce by about 3 to 4 weeks, and some amount of contusions around the nose probably for a few days, and scar mark, which also again is going to be very minimal. Again, by at about 3rd week, that also disappears entirely. But that's just when a small mark just inside or a little underneath the nose out over there. Otherwise, I don't think we're expecting much of injuries around there. Of course, we'll have to be careful, considering that we're going to be doing the surgeries quite carefully. That we are going to be taking care to make sure that there's no injury towards around the eye or on any other part of the face.
One common query we have, is it expensive? Is it covered under insurances?
So now people fly out of the country to actually get their nose jobs and done. So it's mostly like a 16 or an 18-year-old birthday gift these days. It's either an expensive car or probably a nose job. Most of the people would like to get it. That's how conscious everybody has become about it. But if you only look at the cosmetic aspect, I would say I think insurance does not really help the patient to, it doesn't cover rhinoplasty per se. But if a person would have had also an associated nasal obstruction, and we are actually doing this for even a functional defect in the nose, then of course probably that part of the surgery would be covered, and that would actually help them financially out over there. It's expensive. I shouldn't say it's expensive. It's a manageable amount of money, probably in a medical college system, whatever that takes place at about even in a medical college system, it takes about 50,000-60,000 rupees. The same, and probably over here we've been doing it for a good price of almost up to 1.2 to 1.3, which is a good price for the kind of setup and for the kind of good anesthetists, kind of good materials that we have been using, the kind of setup that we have been giving. I think it's a good price that we can go ahead with.
Can we travel after the surgery?
Yeah, I think just per se with rhinoplasty, there are no restrictions for traveling. That is, just as how they are weaning off from their anesthetic effects, they are fit to travel. But of course, as long as my anesthetist clears that the patient can travel, we would ask them not to do that.
Who all can operate now? As in rhinoplasties, who all will be the specialists who can operate on this surgery?
So this is just probably going to be something which we would like to tell for my youngsters who are coming up along with us as students, and probably who wishing to be a rhinoplasty surgeon. That is, yes, just attending a workshop or two, or probably just looking at surgeries over online, 1 or 2 surgeries. I think though we are registered surgeons, I don't think that's the right way to start with rhinoplasty surgery. It's really not rightly to be done. But of course, learning rhinoplasty surgeries by a practice surgeon, doing your fellowships rightly well, and an ENT surgeon maybe after he's completed is now I don't think post ENT we have anything specific other than a fellowship in rhinoplasty entirely that you could do. Plastic surgeons, of course. These days, even oro-maxillofacial surgeons are also been doing the surgery. Yeah, these are. I think we 3 are the rightful people to be getting the rhinoplasty surgery done by.
We have a query that's coming, ma'am. I have got thyroid. I get itching towards the throat, nose, ears. What will be the reason?
Okay, I don't think it's related to rhinoplasty, but yeah. Thyroid, yes, hypothyroidism or hyperthyroidism, either ways are going to influence a lot on even nasal allergy and throat allergies and etc. It can accentuate the allergy quite a bit. I think getting their thyroid levels checked regularly, keeping that in right designated values, and also getting it treated, getting the allergy treated is going to be doing it.
There is one more question, ma'am. Will weight loss affect rhinoplasty?
Not really, not the nose per se. I don't think the skin of the nose really changes much on the nose, but anything around the face, probably, yeah, it could. Or if there's a person who would have wished to have a little bigger nose from what they would have had previously, and they lose weight entirely, maybe the nose looks a little bigger than their face at that point of time, but aesthetically might not be doing much of difference. I'm talking in terms of values and numbers and proportions, but for the face, we don't know. I mean, just as when I mentioned, just before you go ahead with the surgery, if they've had a specific nose for a long period, it's the change that they'll have to accept after a while about it. But no, per se, I don't think nose will do any changes with the weight loss.
With age, ma'am, as someone ages, does this rhinoplasty alter nose, does it make any difference?
It does not. It actually doesn't, but skin does. The skin changes over there around the nose, and that might give a different effect to it. But otherwise, none of the bones or the cartilages which are fixed inside, that nothing should be happening along with the age.
It's a very interesting session. I hope you all enjoyed it. Dr. Suhasini is available at United Hospitals, Janagar. For further queries, any consultations you want for any specific thing, please approach us. We will get you a consultation with Madam. Thank you so much.
Thank you, Maria. Thank you very much.